One part of my work as a sex therapist and a couples counselor is to deal with people who are lesbian, gay, or transgendered. And I deal with some of the transgendered individuals before they have surgery and also after they have surgery, and sometimes before or after hormone treatments. And for example, I had a client not long ago, a woman who was a man. And she had the surgery in Thailand because it was cheaper there, and she wanted to learn how to date because she was very awkward in a way, taking on her new gender as a female. And unlike most transgendered people, she was a lesbian. She really wanted a female lover. Most transgendered people who go from a male to female tend to go for a heterosexual relationship. And so I helped her through all this, just like I would any other individual therapy, telling her how I think she could make connections, how she could flirt, how she could date, and then how she could have sex. And it didn't take very long. She started to meet people, she met a few women, and then after, I'd say about 3 or 4 months, she didn't need me. And so, really the same needs are there emotionally and sexually, whether you're transgendered or gay or lesbian or straight. And so I deal with people, there are some exceptions. You have to have a different emphasis in some ways, like gay couples in terms of what they do sexually, but it's not that different. I mean, you're talking about anal intercourse, you're talking about oral sex, you're talking about being a top or a bottom, and I try to help them realize that you have a more exciting sex life if you're not always in just one role. Why not be a top sometimes and a bottom at other times? And I talk about lesbian creativity. And, there's this whole lesbian bed death issue, where after a while lesbians tend to be less turned on, but the same thing is true for heterosexuals and sometimes gay men. And so I try to get them to vary their sex lives more, to use some humor, and to not just put such a focus on children, because lesbian couples with children tend to not have sex hardly at all. And after a few years, they don't. And so there are whole studies on this. And I believe these problems could be fixed, but it takes a creative, imaginative, and I think somewhat humorous approach to solve these problems.